In this video, we are going to talk about depression, breaking the silence, understanding depression, what it is and who it affects. Because equipped with a better understanding of depression, you may be able to better support someone in your life facing depression. So first of all, understanding depression. Depressive disorder, also known as depression, is a common mental health disorder that affects millions of people worldwide. It is characterized by depressed mood, loss of pleasure and interest in various activities for longer periods of time. It is different from regular mood changes and feelings associated with everyday life because it involves persistent feelings of sadness, hopelessness, and a loss of interest in activities that were once enjoyable. It affects all aspects of life, including relationship with family, friends, and community. It can result from or lead to problems at school or work. Next, what are the causes of depression? So first of all, abuse. Physical, sexual, or emotional abuse can make you vulnerable to depression later in life. Age. People who are elderly are at a higher risk of depression. Medication. Certain medications or some drugs can increase your risk of depression. Death or loss. Sadness or grief after the death or loss of a loved one can increase the risk of depression. Gender. Women are about twice as likely as men to become depressed. Genes. A family history of depression may increase the risk of depression. Illness. A serious illness, sometimes depression happens along with a major illness or may be triggered by another medical condition. Social isolation. Social isolation or being cast out of a family or social group can contribute to the risk of developing clinical depression. So other causes of depression include starting a new job, graduating, getting married, losing a job, divorce, or retirement. So next is symptoms of depression. First of all, poor concentration. A person with poor concentration finds it hard to focus and might be easily distracted. Feeling of guilt or low self-worth. So constant self-criticism can lead to persistent feelings of sadness, shame, or guilt, and low self-esteem reduces the quality of a person's life. Hopelessness about future. People with a sense of hopelessness will lose interest in regular life activities that they had no problem dealing with, such as finding it difficult to leave the bed, skipping meals, not taking baths regularly are common symptoms of hopelessness. Next, suicidal thoughts. This means having abstract thoughts about ending your life or feeling that people would be better off without you, or thinking about methods of suicide or making clear plans to take your own life. Next is disrupted sleep. Sleep disturbances are linked to both physical and emotional problems. Sleep problems can both contribute to or increase mental health conditions and can be a symptom of other mental health conditions as well. Changes in appetite and weight. Appetite and weight changes are common but variable diagnostic markers in major depressive disorder. For example, some depressed individuals manifest increased appetite while others lose their appetite. Next is feeling tired or low in energy. Fatigue can be one of the first and most noticeable symptoms of depression.